1. A nurse is caring for a patient with mild Alzheimer's disease who forgets to take medications. What is the most effective intervention to ensure adherence? A. Rely on family to administer all doses. B. Use a labeled pill organizer and provide reminders. C. Discontinue medications to simplify the routine. D. Administer all medications in the morning. Answer. B. Use a labeled pill organizer and provide reminders. Rationale. In mild Alzheimer's, a labeled pill organizer and reminders. B. Promote independence and adherence. Relying solely on family. A. Reduces autonomy. Discontinuing medications. C. Is unsafe without medical consultation. Administering all medications in the morning. D. May not align with prescribed schedules. 2. A patient with moderate Alzheimer's disease is wandering at night. What is the priority nursing action? A. Restrain the patient to prevent falls. B. Increase room lighting to reduce confusion. C. Assess for unmet needs such as hunger or toileting. D. Administer a sedative to promote sleep. Answer. C. Assess for unmet needs such as hunger or toileting. Rationale. Wandering may indicate unmet needs like hunger or toileting. C. Which should be assessed first. Restraints. A. Are a last resort and may increase agitation. Increased lighting. B. May help but is not the priority. Sedatives. D. Require assessment and a prescription and may not address the cause. 3. A nurse is assessing a patient with suspected Alzheimer's disease. Which symptom is most indicative of early-stage disease? A. Severe memory loss. B. Difficulty with short-term memory. C. Complete disorientation. D. Inability to perform self-care. Answer. B. Difficulty with short-term memory. Rationale. Difficulty with short-term memory. B. Is a hallmark of early Alzheimer's disease, such as forgetting recent events. Severe memory loss. A. And complete disorientation. C. Occur in later stages. Inability to perform self-care. D. Is more common in moderate to late stages. 4. A patient with severe Alzheimer's disease is refusing to eat. What should the nurse do first? A. Force feed the patient to ensure nutrition. B. Offer a high-calorie supplement immediately. C. Assess for underlying causes like pain or dysphagia. D. Restrict fluids to stimulate appetite. Answer. C. Assess for underlying causes like pain or dysphagia. Rationale. Refusal to eat may stem from pain or dysphagia. C. Which must be assessed first. Force feeding. A. Is unethical and unsafe. Supplements. B. May be considered later, but do not address the cause. Restricting fluids. D. Is inappropriate and may worsen dehydration. 5. A family member of a patient with Alzheimer's disease asks how to communicate effectively. What is the best advice? A. Speak loudly to ensure the patient hears. B. Use complex sentences to stimulate cognition. C. Use simple words and maintain eye contact. D. Avoid speaking directly to the patient. Answer. C. Use simple words and maintain eye contact. Rationale. Simple words and eye contact. C. Facilitate understanding and engagement. Speaking loudly. A. May cause distress without improving comprehension. Complex sentences. B. Can confuse the patient. Avoiding direct communication. D. Reduces dignity and connection. 6. A nurse is educating a caregiver about safety for a patient with Alzheimer's disease. Which intervention is most important? A. Install locks on all interior doors. B. Remove rugs and clutter to prevent falls. C. Allow the patient to wander freely. D. Keep medications in an unlocked cabinet. Answer. B. Remove rugs and clutter to prevent falls. Rationale. Removing rugs and clutter. B. Reduces fall risk, a priority for safety. Locking all doors. A. May trap the patient in unsafe situations. Allowing wandering. C. Increases risk of injury or getting lost. Unlocked medications. D. Pose a risk of overdose. 7. A patient with Alzheimer's disease is prescribed donepezil. What should the nurse monitor for? A. Increased appetite. B. Improved long-term memory. C. Gastrointestinal side effects. D. Decreased blood pressure. Answer: C. Gastrointestinal side effects. Rationale: donepezil, a cholinesterase inhibitor, commonly causes gastrointestinal side effects, C, like nausea or diarrhea. It may not increase appetite, A, or improve long-term memory, B. Decreased blood pressure, D, is not a primary side effect. 8. A nurse is discussing advanced directives with a patient in early Alzheimer's disease. What is the priority? A. Encourage the patient to delay decision-making. B. Ensure the patient understands and expresses wishes. C. Have the family make decisions without patient input. D. Avoid discussing legal matters to reduce stress. Answer: B. Ensure the patient understands and expresses wishes. Rationale: in early Alzheimer's, patients often retain decision-making capacity, so ensuring understanding and documenting wishes, B, is critical. Delaying, A, risks loss of capacity. Family decisions, C, should involve the patient. Avoiding discussion, D, neglects ethical responsibilities. 9. A patient with moderate Alzheimer's disease is at risk for skin breakdown. What is the best nursing intervention? A. Limit repositioning to reduce agitation. B. Use a pressure-relieving mattress and reposition frequently. C. Apply restraints to keep the patient in one position. D. Reduce hygiene care to minimize skin irritation. Answer: B. Use a pressure-relieving mattress and reposition frequently. Rationale: a pressure-relieving mattress and frequent repositioning, B, prevents skin breakdown. Limiting repositioning, A, increases risk. Restraints, C, are unsafe and unethical. Reducing hygiene, D, may lead to infections. 10. A nurse is prioritizing care for a patient with late-stage Alzheimer's disease who is bedbound. What is the most critical action? A. Encourage ambulation to maintain strength. B. Monitor for signs of aspiration during feeding. C. Limit fluid intake to reduce urinary output. D. Avoid turning to prevent discomfort. Answer: B. Monitor for signs of aspiration during feeding. Rationale: bedbound patients with late-stage Alzheimer's are at high risk for aspiration, B, a life-threatening complication, making monitoring critical. Ambulation, A, is not feasible. Limiting fluids, C, risks dehydration. Avoiding turning, D, increases pressure ulcer risk. 11. A nurse is teaching a caregiver about managing sundowning in a patient with Alzheimer's disease. Which strategy is most effective? A. Increase evening activities to keep the patient alert. B. Maintain a calm environment with dim lighting. C. Encourage napping throughout the day. D. Administer caffeine to reduce fatigue. Answer: B. Maintain a calm environment with dim lighting. Rationale: sundowning, increased agitation in the evening, is best managed with a calm environment and dim lighting, B, to reduce stimulation. Increasing activities, A, may worsen agitation. Excessive napping, C, can disrupt sleep patterns. Caffeine, D, may increase restlessness and is inappropriate. 12. A patient with early Alzheimer's disease is anxious about forgetting appointments. What should the nurse recommend? A. Avoid scheduling appointments to reduce stress. B. Use a digital calendar with audible reminders. C. Rely on family to manage all appointments. D. Discontinue all non-essential activities. Answer: B. Use a digital calendar with audible reminders. Rationale: a digital calendar with reminders, B, supports independence and reduces anxiety in early Alzheimer's. Avoiding appointments, A, may isolate the patient. Relying on family, C, reduces autonomy. Discontinuing activities, D, may decrease quality of life. 13. A nurse observes a patient with moderate Alzheimer's disease hiding objects. What is the best response? A. Confront the patient about hiding items. B. Search for hidden objects without addressing the behavior. C. Provide a safe place for the patient to store items. D. Restrict the patient's access to personal belongings. Answer: C. Provide a safe place for the patient to store items. Rationale: Hiding objects is common in moderate Alzheimer's, providing a safe storage place. C. Addresses the behavior respectfully. Confronting. A. May cause distress. Searching without addressing. B. Ignores the underlying need. Restricting access. D. Reduces dignity. 14. A nurse is caring for a patient with Alzheimer's disease who is experiencing sundowning. What is the best intervention? A. Increase evening activities to tire the patient. B. Encourage napping throughout the day. C. Maintain a calm environment with dim lighting. D. Administer caffeine to reduce fatigue. Answer. C. Maintain a calm environment with dim lighting. Rationale. A calm environment with dim lighting. C. Reduces sundowning agitation. Increased activities. A. Or caffeine. D. May worsen symptoms. Napping. B. Disrupts nighttime sleep. 15. A patient with early Alzheimer's disease asks about slowing disease progression. What should the nurse recommend? A. Avoid all physical activity to reduce stress. B. Limit social interactions to avoid confusion. C. Increase alcohol consumption to relax. D. Engage in regular exercise and a healthy diet. Answer. D. Engage in regular exercise and a healthy diet. Rationale. Exercise and a healthy diet. D. May slow progression. Avoiding activity. A. Or social interactions. B. May worsen health. Alcohol. C. Exacerbates decline. 16. A nurse is assessing a patient with Alzheimer's disease for depression. Which symptom is most indicative? A. Increased energy levels. B. Persistent sadness and withdrawal. C. Improved cognitive function. D. Excessive physical activity. Answer. B. Persistent sadness and withdrawal. Rationale. Persistent sadness and withdrawal. B. Indicate depression. Increased energy. A. Improved cognition. C. Or excessive activity. D. Are not typical. 17. A patient with moderate Alzheimer's disease is at risk for falls. What is the best intervention? A. Keep the bed in the highest position. B. Restrain the patient during ambulation. C. Ensure clear pathways and adequate lighting. D. Limit mobility to prevent accidents. Answer. C. Ensure clear pathways and adequate lighting. Rationale. Clear pathways and lighting. C. Reduce fall risk. High beds. A. Increase risk. Restraints. B. Are unsafe. Limiting mobility. D. Causes deconditioning. 18. A caregiver asks how to manage repetitive questions in a patient with Alzheimer's disease. What is the best response? A. Ignore the questions to discourage repetition. B. Restrict the patient's interactions. C. Correct the patient each time. D. Answer calmly, with simple responses. Answer. D. Answer calmly, with simple responses. Rationale. Calm, simple responses. D. Reduce anxiety. Ignoring. A. Or correcting. C. May distress. Restricting interactions. B. Reduces engagement. 19. A patient with severe Alzheimer's disease is at risk for pressure ulcers. What is the priority? A. Use a pressure-relieving mattress and turn frequently. B. Limit repositioning to reduce agitation. C. Restrict hygiene to avoid irritation. D. Keep the patient in one position. Answer. A. Use a pressure-relieving mattress and turn frequently. Rationale. A pressure-relieving mattress and frequent turning. A. Prevent ulcers. Limiting repositioning. B. Or keeping one position. D. Increases risk. Restricting hygiene. C. Risks infection. 20. A nurse is discussing legal issues with a family of a patient with Alzheimer's disease. What is the priority? A. Avoid legal planning to reduce stress. B. Discuss advance directives and guardianship. C. Encourage the patient to manage all legal affairs. D. Appoint a guardian without discussion. Answer. B. Discuss advance directives and guardianship. Rationale. Discussing advance directives and guardianship. B. Ensures legal planning. Encouraging all decisions. C. May be unsafe. Avoiding planning. A. Neglects needs. Appointing without discussion. D. Is unethical. 21. A patient with Alzheimer's disease is refusing to bathe. What should the nurse do first? A. Assess reasons for refusal and offer alternatives. B. Force the patient to bathe. C. Restrain the patient during bathing. D. Avoid bathing to prevent agitation. Answer. A. Assess reasons for refusal and offer alternatives. Rationale. Assessing reasons and offering alternatives A. Respects autonomy. Forcing B. or restraining C. violates rights. Avoiding bathing D. risks hygiene issues. 22. A nurse is caring for a patient with Alzheimer's disease who is hallucinating. What is the best response? A. Argue with the patient about reality. B. Ignore the hallucinations completely. C. Administer an antipsychotic immediately. D. Acknowledge the patient's fear and redirect. Answer. D. Acknowledge the patient's fear and redirect. Rationale. Acknowledging fear and redirecting. D. Reduces distress. Arguing A. May agitate. Antipsychotics C. require assessment. Ignoring B. dismisses the patient. 23. A patient with Alzheimer's disease is at risk for dehydration. What should the nurse do? A. Restrict fluids to prevent choking. B. Offer thickened liquids in small amounts. C. Administer for fluids without assessment. D. Limit oral intake to solids only. Answer. B. Offer thickened liquids in small amounts. Rationale. Thickened liquids in small amounts. B. Prevent dehydration safely. Restricting fluids A. worsens dehydration. For fluids C. require assessment. Solids only D. do not hydrate. 24. A nurse is discussing end-of-life care for a patient with Alzheimer's disease. What is the priority? A. Encourage aggressive medical interventions. B. Recommend immediate facility placement. C. Avoid discussing comfort measures. D. Honor the patient's advance directives. Answer. D. Honor the patient's advance directives. Rationale. Honoring advance directives D. ensures ethical care. Aggressive interventions A. may not align with wishes. Avoiding comfort measures C. neglects care. Immediate placement B. is not the priority. 25. A patient with early Alzheimer's disease asks about brain health. What should the nurse recommend? A. Avoid all cognitive activities. B. Increase saturated fat intake. C. Engage in regular mental stimulation. D. Limit sleep to stay alert. Answer. C. Engage in regular mental stimulation. Rationale. Mental stimulation C. supports brain health. Avoiding activities A. or limiting sleep D. may worsen decline. Saturated fats B. are not beneficial. 26. A nurse is caring for a patient with Alzheimer's disease who is combative. What should the nurse do first? A. Restrain the patient to ensure safety. B. Assess for triggers like pain or fear. C. Administer a sedative immediately. D. Ignore the behavior to avoid escalation. Answer. B. Assess for triggers like pain or fear. Rationale. Assessing triggers like pain or fear. B. Addresses combativeness. Restraints A. are unsafe. Ignoring D. dismisses needs. Sedatives C. require assessment. 27. A patient with moderate Alzheimer's disease is at risk for aspiration. What is the priority? A. Encourage thin liquids to aid swallowing. B. Use large utensils to increase intake. C. Avoid feeding to prevent aspiration. D. Position upright and monitor swallowing. Answer. D. Position upright and monitor swallowing. Rationale. Upright positioning and monitoring. D. Reduce aspiration risk. Thin liquids A. increase risk. Avoiding feeding C. causes malnutrition. Large utensils B. do not help. 28. A nurse is teaching about cholinesterase inhibitors for Alzheimer's disease. What is their primary effect? A. Cure Alzheimer's disease. B. Temporarily improve cognitive function. C. Prevent behavioral symptoms. D. Reverse memory loss completely. Answer. B. Temporarily improve cognitive function. Rationale: cholinesterase inhibitors, B, temporarily improve cognition. They do not cure Alzheimer's, A, prevent behaviors, C, or reverse memory loss, D. 29. A patient with Alzheimer's disease is hoarding objects. What should the nurse do? A, confront the patient about hoarding. B, restrict access to all objects. C, provide a safe space for storing items. D, ignore the behavior completely. Answer: C, provide a safe space for storing items. Rationale: a safe storage space, C, addresses hoarding respectfully. Confronting, A, may distress. Restricting objects, B, reduces dignity. Ignoring, D, does not address the behavior. 30. A family asks about supporting a patient with late-stage Alzheimer's disease. What is the best recommendation? A, encourage complex tasks to stimulate cognition. B, promote independence in daily activities. C, limit sensory stimulation to reduce stress. D, provide comfort through touch and music. Answer: D, provide comfort through touch and music. Rationale: touch and music, D, provide comfort in late-stage Alzheimer's. Complex tasks, A, or independence, B, are not feasible. Limiting stimulation, C, may isolate. 31. A patient with Alzheimer's disease is at risk for elopement. What is the best safety measure? A, keep all doors unlocked for access. B, restrain the patient during the day. C, use a WanderGuard bracelet. D, limit supervision to nighttime. Answer: C, use a WanderGuard bracelet. Rationale: a WanderGuard bracelet, C, prevents elopement safely. Unlocked doors, A, risk safety. Restraints, B, are unethical. Limited supervision, D, is unsafe. 32. A nurse is discussing palliative care with a family of a patient with late-stage Alzheimer's disease. What is the focus? A, aggressive treatment to prolong life. B, comfort and quality of life. C, encouraging ambulation daily. D, limiting family involvement. Answer: B, comfort and quality of life. Rationale: palliative care focuses on comfort and quality of life. B, aggressive treatment, A, may not align with goals. Ambulation, C, is not feasible. Limiting family, D, is inappropriate. 33. A patient with early Alzheimer's disease asks about cognitive exercises. What should the nurse recommend? A, avoid mental activities to reduce stress. B, limit learning to avoid frustration. C, focus only on physical exercise. D, engage in puzzles and reading. Answer: D, engage in puzzles and reading. Rationale: puzzles and reading, D, stimulate cognition. Avoiding activities, A, or limiting learning, B, may worsen decline. Physical exercise alone, C, is insufficient. 34. A nurse is caring for a patient with Alzheimer's disease who is verbally aggressive. What should the nurse do? A, use a calm tone and validate emotions. B, argue with the patient to clarify reality. C, restrain the patient to ensure safety. D, ignore the behavior completely. Answer: A, use a calm tone and validate emotions. Rationale: a calm tone and validating emotions, A, de-escalate aggression. Arguing, B, or restraining, C, may worsen behavior. Ignoring, D, dismisses needs. 35. A patient with moderate Alzheimer's disease is at risk for malnutrition. What is the best intervention? A, offer large meals to increase intake. B, restrict fluids to stimulate appetite. C, provide nutrient-dense finger foods. D, limit feeding to reduce choking. Answer: C, provide nutrient-dense finger foods. Rationale: nutrient-dense finger foods, C, encourage intake. Large meals, A, may overwhelm. Restricting fluids, B, risks dehydration. Limiting feeding, D, worsens malnutrition. 36. A nurse is teaching about Alzheimer's disease progression. Which statement is correct? A, cognitive function improves over time. B, symptoms worsen progressively. C, behavioral issues resolve in late stages. D, Memory remains stable throughout. Answer. B. Symptoms worsen progressively. Rationale. Alzheimer's symptoms worsen progressively. B. Cognitive function does not improve. A. Behaviors do not resolve. C. And memory declines. D. 37. A patient with Alzheimer's disease is hallucinating. What should the nurse do? A. Administer an antipsychotic immediately. B. Acknowledge the patient's fear and redirect. C. Argue with the patient about reality. D. Ignore the hallucinations completely. Answer. B. Acknowledge the patient's fear and redirect. Rationale. Acknowledging fear and redirecting. B. Reduces distress. Arguing. C. May agitate. Antipsychotics. A. Require assessment. Ignoring. D. Dismisses the patient. 38. A caregiver asks how to prevent falls in a patient with Alzheimer's disease. What is the best suggestion? A. Keep the environment dimly lit. B. Install handrails and remove rugs. C. Encourage barefoot walking. D. Restrict mobility to avoid falls. Answer. B. Install handrails and remove rugs. Rationale. Handrails and rug removal. B. Prevent falls. Dim lighting. A. Increases risk. Barefoot walking. C. May be unsafe. Restricting mobility. D. Causes deconditioning. 39. A patient with severe Alzheimer's disease is incontinent. What is the best nursing intervention? A. Restrict fluids to reduce incontinence. B. Avoid hygiene to reduce agitation. C. Use absorbent pads and a toileting schedule. D. Restrain the patient to keep dry. Answer. C. Use absorbent pads and a toileting schedule. Rationale. Absorbent pads and a toileting schedule. C. Manage incontinence. Restricting fluids. A. Risks dehydration. Avoiding hygiene. B. Increases infection risk. Restraints. D. Are unsafe. 40. A nurse is discussing guardianship for a patient with Alzheimer's disease. What is the first step? A. Appoint a guardian without assessment. B. Encourage the patient to make all decisions. C. Evaluate the patient's decision-making capacity. D. Avoid legal discussions to reduce stress. Answer. C. Evaluate the patient's decision-making capacity. Rationale. Evaluating decision-making capacity. C. Determines guardianship needs. Appointing without assessment. A. Is unethical. Encouraging all decisions. B. May be unsafe. Avoiding discussions. D. Neglects needs.